lots of people have impacted me in a big way in this work for sure. My former director, Kathleen Waxer, she's since become a counselor. Her work has really set the foundation for what I do now in this role, and what I do as an animator. It's really impacted the work I do. So she's the one that kind of set up the Jasper community team in the 1990s, and she set up a really incredible system that's still kind of thriving today. And then I work alongside frontline support workers called outreach workers here in Jasper, and their work I feel like is just inspiring on a daily basis. They are just holding space for people during incredibly challenging, vulnerable times, and I'm just inspired by what they do all the time. When I first started here, I was an outreach worker for a short time, for 2 years, and some of the people I got to work with and get to know, and the stories that I heard have really impacted my life, and really, I think, changed my perspective. So yeah, I really just kind of work in an office where you just get to know how vulnerability and marginalization are not permanent states, and how it can just kind of creep up on anyone. And yeah, when I think about what's working in this town, and I really think about the model that I get to just simply work within, not something that I developed myself, but like I said, it was the Jasper community team started in the 90s. And a really key difference that I notice whenever I'm liaising or connecting with other groups around the province is that it's based on age group, not on issues. And it allows us to focus on people instead of problems. And so we engage with our community in these 4 different age groups or life stage conversations. There's one on early childhood, one on school age kids, one on adults, and then a 4th on seniors. And by focusing on, let's say, for example, the early childhood age group, you're starting to see the trends impacting that age group and the opportunities that exist to work together across sectors to support those people. And what you really see is that social issues are not singular, and they don't exist as a single issue. So like the challenge of mental health in new parents is not a singular issue. It's really complex, and it requires a cross-sector, complex, multifaceted response, which I feel like the Jasper community team and this model in general is really set up to produce that response, because we're not only talking about mental health, we're talking about all sorts of other stuff too that play in together with that. So I feel like in a small town where there's just constant change in our population, this model has served so well, and I've seen so many benefits of really speaking about social issues holistically with so many different partners around the table, and a lot of unusual partners. You might not be like, oh, we really need this person here to talk about mental health, but when you're talking about young children, you're like, oh yeah, it makes sense for them to be here, and then they end up having like the best idea around mental health.